วันนี้หมอตุ๊กจะมาแนะนำเครื่องมือใหม่ของ SLV นะคะที่ใช้ในการตรวจค้นหาโรคไตระยะเริ่มต้นกันค่ะที่ต้องตื่นเต้นกับเครื่องมือนี้ก็เพราะว่ากว่าเจ้าของเองจะรู้ว่าสัตว์เลี้ยงของเราป่วยด้วยโรคไตเนี่ยวันนั้นมันก็เป็นวันที่สายเกินไปซะแล้วค่ะไตวายในระยะที่น้องหมาน้องแมวเริ่มมีอาการมันคือไตวายเรื้อรังระยะที่2ซึ่งเป็นไตวายที่มีการสูญเสียพื้นที่การทำงานไปแล้ว 67% พูดง่ายๆก็คือว่าวันนั้นเขาเหลือเวลาอยู่กับเราได้อีกไม่นานแล้วด้วยเหตุนี้ค่ะทาง SLV ก็เลยนำ Sdma ซึ่งก็คือ Biomarker ตัวใหม่ล่าสุดที่สามารถตรวจค้นหาโรคไตในระยะเริ่มต้นคือระยะที่เสื่อมแค่ประมาณ 40% ของเนื้อไตทั้งหมดและเมื่อเรารู้เร็วค่ะเราก็สามารถที่จะวางแผนในการรักษาป้องกันแล้วก็ควบคุมให้เขาสามารถอยู่กับเราได้อีกนาน
Hello, I'm Greg Grauer, a small animal internist from the College of Veterinary Medicine at Kansas State University. I am fortunate to be one of the members of the International Renal Interest Society, and I'm here today to talk about the IRIS chronic kidney disease staging system. The IRIS group is made up of 15 independent veterinarians from 10 different countries, all who share an interest and expertise in veterinary nephrology. Our mission is to help veterinary practitioners better diagnose, understand, and treat kidney disease in dogs and cats. One of our first projects was to establish staging guidelines for chronic kidney disease in order to better tailor diagnostics and therapeutics to individual dogs and cats based on their stage of disease. We review and update these guidelines regularly to reflect new advances in the diagnosis and treatment of chronic kidney disease. To this end, IRIS recently updated the guidelines for chronic kidney disease to include the kidney biomarker Sdma. Compared with creatinine, we recognize that Sdma may be a more sensitive and reliable biomarker of excretory renal function, and that Sdma can be a useful adjunct for early diagnosis of chronic kidney disease, as well as a guide for management of more advanced chronic kidney disease. Because Sdma has been shown to increase prior to creatinine in many dogs and cats with early, i.e. stage 1 chronic kidney disease, a persistently increased Sdma can indicate reduced renal function and can be helpful for diagnosing early CKD before the patient becomes azotemic. A persistent increase in Sdma greater than 14 micrograms per deciliter suggests reduced renal function and may be a reason to consider a dog or cat with creatinine values less than 1.4 or 1.6 respectively as IRIS CKD stage 1. Evaluation of more than one Sdma concentration is critical in order to demonstrate persistence and rule out pre-renal increases in Sdma. In patients that are persistently azotemic with inappropriately concentrated urine, Sdma is an additional diagnostic tool to increase your confidence that the pet indeed has reduced kidney function and has CKD. This may be particularly helpful in cases where the serum creatinine concentration is just above the reference interval or oscillating above and below the upper end of the reference interval, or if just the BUN or creatinine is increased. Sdma can also be useful for guiding treatment of CKD. Since creatinine is a breakdown product of muscle and can be impacted by a pet's lean muscle mass, serum creatinine concentrations may underestimate the degree of kidney dysfunction in pets with decreased muscle mass. It has been shown that Sdma is not impacted by muscle condition and can be a more reliable indicator of progression of chronic kidney disease as dogs and cats lose lean body mass. In IRIS CKD stage 2 patients with low body condition scores, Sdma concentrations greater than or equal to 25 micrograms per deciliter may indicate the degree of renal dysfunction has been underestimated and one may want to consider treatment recommendations listed under IRIS-CKD Stage 3. Similarly, in Stage 3 patients with low body condition scores, Sdma concentrations greater than or equal to 45 micrograms per deciliter may indicate the degree of renal dysfunction has again been underestimated, and one may want to consider treatment recommendations listed under IRIS-CKD Stage 4. These guideline modifications are preliminary and based on early data from the use of Sdma in veterinary patients. We expect these guidelines to be updated as the veterinary profession gains further experience using Sdma alongside creatinine, the long-established marker for diagnosis and monitoring of canine and feline CKD. We hope that increased recognition, monitoring, and management of dogs and cats with Stage 1 CKD, as well as considering more aggressive treatment for dogs and cats with later stage CKD that have disproportionately high serum Sdma concentrations, will not only improve the quality of life, but might also prolong survival time.